Thank you, Mrs. Beader.
The reduction of health inequalities in the EU is, as you know, a major priority for the European public health strategy, notably reflected in the social investment package and the third programme for the Union's action in the field of health up to 2020, for which you would be responsible. An integral part of public health strategies at national level is sexual and reproductive health and rights. They are essential for improving the general health status of the population. Yet looking across the Union, health indicators show blatant discrepancies and inequalities affecting citizens. They show a significant difference in rates of maternal mortality, the incidence of sexually transmitted diseases and infections, and access to obstetrics care. Will you therefore consider mainstreaming sexual and reproductive health and rights into the future European public health strategies and ensure that the tools and programmes aimed at its implementation are supported? Will you also commit to supporting a European and a human rights approach on sexual and reproductive health and rights in order to guarantee access to information, prevention services and intervention for all, thus reducing inequalities across the Union?
Manau, kad šios sudėties Europos komisijoje yra.
I believe that European Commission in its current constituency gives a big emphasis on the portfolio on the first Vice Minister of the Commission, Vice President of the Commission. He is responsible for the implementation of the Charter of the Fundamental Rights. As a commissioner responsible for health and food safety, I will definitely discuss all these issues with the first Vice President, because these issues are common to us. Respect to human rights, protection of everybody's human rights, including patients' rights, is priority number one for us. In my previous life, I have had chances to include patients in the discussions on healthcare services and other related issues. I think that other countries as well discuss how to improve the patient's ability to be an active decision-making participant. Every patient has to be able to express his opinion, to make an influence. In this context, we speak about social determination, and I could mention the study by Michael Marmont, commissioned by the World Health Organization. I believe that all of us have to read it. It reveals the situation of social differences in the EU member states. In the 5 upcoming years, we have to find some sophisticated measures to diminish these differences, and I think that Europe would become closer to citizens that way.